Okay, welcome everyone. I think we've got everybody in the room and we're ready to kick off. I'll quickly ask if there's any other additional media who've joined us. Who've not already reported it? No? Okay, so we are just about to get underway. Let me just get up to the podium and we'll start things. Okay, welcome everyone. Thank you so much for joining us. Such a last minute media briefing, but for a very important reason in our community. Very pleased to have with us today representatives from the Kawartha District School Board, the board chair, Diane Lloyd, and Director of Education, Jennifer Leclerc, to talk about the cases that were reported yesterday at the Adam Scott CDI. So before we get underway, just take a moment to pause, and we'd like to offer a land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Michi-Saagiig territory and in the traditional territory of the Michi-Saagiig and Chippewa nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Bosolai, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. We also recognize the unique history, culture, and traditions of the many Indigenous peoples with whom we share this time and space. We give thanks to the Métis, the Inuit, and the many other First Nations peoples for their contributions as we strengthen ties, serve their communities, and responsibly honor all residents, all of our relations. Now I would like to invite Dr. Rosanna Salvatierra, Medical Officer of Health, up to the podium to talk about the cases.
Thank you, Brittany. Late yesterday afternoon, we were notified of positive COVID results, and upon contact with the individuals, discovered that 3 were students of Adam Scott, a school located within the city of Peterborough. Fortunately, the illnesses are mild and all 3 are recovering at home in self-isolation. In our preliminary investigation of these cases, we determined that all 3 had spent some time in the school during the period where they could have been shedding the virus. We were able to gather the necessary information to quickly convene a meeting with school and school board officials, and we called in additional staff to assist with contact notification. By 7:30 p.m. last night, we had identified the staff and student cohorts that would need to be excluded as possible high-risk contacts, and had collaborated on communication to staff, parents, and students that was relayed immediately by the school principal. Public health staff were able to call all but 3 of the contacts last night to advise them to stay at home. By early this morning, everyone had been contacted. We are still early in this investigation, but at this time, we do not believe that transmission occurred in the school. These cases are known to each other and have contact outside of the school setting. For this reason, we have not declared an outbreak. The school was advised that they could safely open today and continue to operate until further notice. I want to ensure the students and staff of Adam Scott and their families that Peterborough Public Health will notify them if, in the course of the investigation, we determine that they need to take any precautions. Until then, it is life as normal, or as normal as it can be during a pandemic. We ask everyone to carry on with the work of learning, using the public health measures like self-monitoring and staying home if sick, good hand hygiene, physical distancing, limiting contacts both in and out of school, and wearing face coverings when indoors, at school, or any time a 2-meter distance cannot be maintained. I ask that all business operators and service providers in Peterborough ensure that these staff and students and their families are not unnecessarily turned away or shunned in any way. Let's stay calm and let's stay smart. I do not wish to see a rush on testing. We need to stay away from the drive-through site today unless a public health nurse advises you to go for testing. You will be given an investigation number. If you have symptoms, take the online self-assessment test and only call the assessment center at PRHC if directed to do so. Please do not call otherwise. We must remain calm and allow all of the healthcare partners to do our work to keep our community safe. Before I turn this over to our education partners who have been working so hard to make schools safe for everyone, I just want to point out that so far in our investigation, we have been happy to see that because staff at the school were consistently wearing medical masks and face shields appropriately, we were able to assess them as low-risk contacts. Good job, everyone. If there is anything more that could have been done in preparation, I would say it would be for all of us and anyone in a secondary or post-secondary setting to download and use the COVID Alert app. The app allows a positive case to enter a code that would provide instant notification to anyone who was within 2 meters for 15 minutes or more. The more of us who have this app on our phones, the faster we will all know if we are at any increased risk and need to be tested. Thank you.
And thank you, Dr. Salvatierra. And now I would like to invite our representatives from the Kawartha Pioneer District School Board, Board Chair Diane Lloyd.
Thank you. As always, the well-being of our students and staff is the top priority. This is certainly top of mind today and last evening as we work collaboratively with our partners at Peterborough Public Health to respond to the news that we had 3 positive COVID cases at Adams Scott Collegiate. We were notified late yesterday afternoon by Peterborough Public Health that we had 3 confirmed cases of COVID-19 at Adams Scott CDI. Peterborough Public Health does not believe that these cases were transmitted through the school. We immediately began to coordinate response to the news. Understandably, these are fluid situations, and the goal is to try and confirm and finalize correct information as it is known, and then to get that information to our families and staff as soon as possible. As soon as we're able. Because we know that no one communication is perfect when sharing information after school hours, we rely on a number of different platforms and communication channels. Once we finalized our notice with the health unit, we shared that information through a letter sent to all Adams Scott families, intermediate and secondary, through school messenger email system. A letter was also emailed to staff. Information was posted on the Adams Scott CDI and intermediate school EDSB communication platforms. Information was posted on both school websites. Information was posted on both our board and school Twitter accounts, Facebook and Instagram social media channels. The letter was also pasted on the school board website, and COVID reporting webpage was updated. At the same time, Public Health was mobilizing to identify and be directly in touch with all close contacts at the school who needed to take extra self-isolation today. We want to reassure parents and staff that we take our responsibility very seriously for the safety of all of our students. We also appreciate that parents and students are anxious. That is understandable, and what we would say is that we have strong safety measures in place that we continue to refine each day. Our schools are safe places to be, and we do have students and staff at Adams Scott this morning. Thank you.
Thank you very much, Diane. So now we will open it up to questions from the media. I'm going to work down the list of everyone who signed in today. And if our media partners could be clear on who the question is directed towards, they'll make their way up to the podium to answer it. So first we have Taylor Clydesdale from Peterborough This Week. If you've got some questions, Taylor, go right ahead.
Yes, thank you. Just in regards to outbreaks, is it possible that the school could be closed if there's a high enough number of cases, even if an outbreak isn't officially declared?
It's Dr. Salvatore speaking. I mean, you raise a hypothetical question in a scenario. It's unusual to see a large number of cases in one setting and not have some kind of a link. So I think it would be highly unusual to have a number of cases that weren't somehow linked to the setting. However, it is possible. Hypothetically, it is possible. If you have enough people in one setting who are having exposures elsewhere, you could potentially have a large number of cases and not have an outbreak in the one setting that they share.
If that were to happen, would the school be closed? And actually, I guess the question should be, what would it take in order for Adam Scott or any other school to be closed?
So I think what's important is that the outbreak measures are taken in a proactive way in order to eliminate from the school setting anyone who is at higher risk of potentially transmitting the infection. And that happened last night. So all contacts, whether they were high risk contacts or potentially even low risk contacts, if they were within the cohort of the cases, they have been asked to stay home. So I think we have done a very preemptive strike, even outside of declaring this an outbreak, to ensure that we've reduced the risk and we can allow the school to continue. If that were to change, and if we had evidence of transmission occurring in other parts of the school, for example, we might choose to close it just to try and bring things down under control. And you know that's happened in some other parts of the province. It certainly isn't needed here at this time.
Just the last question then. What is defined as transmission within the school? Does transmission of the virus actually have to take place because the virus was shed in the classroom or in the hallways of the school? Or is it still considered transmission in the school if the kids are, or staff for that matter, spread it outside the confines of school property, but they were in contact because they are in the same setting every day?
Again, I'm going to try and sort through what you've asked. So for an outbreak to be declared, you need at least 2 cases in the school with some risk or evidence that the actual infection was transmitted or acquired in the school. And now, what's included in the school? Well, some of the settings you have identified, we would include. So, for example, a school bus or a before and after school program. All of those settings are considered are related to the school. But a party at someone's home on Friday night is not. So it really depends on where the transmission has occurred. And you know, this age group, and certainly by this age group, I'm speaking about not only school students, but adults in Ontario right now, we are seeing transmission in younger adults and in youth. And this is not necessarily occurring at school, but it's occurring in unorganized social gatherings. And that's where we really need to be doing much more to shrink down our social bubbles, stay in our own homes, and be very careful about any kind of socialization after hours and on weekends.
Okay, I think that's it for me. Thank you for now.
Okay. Thank you, Taylor. So Joelle from the Examiner, you're next, and if you can let us know who your question is directed towards, that'd be great.
Okay, this is a question for Dr. Salvatore. How many contact people were called, it sounds like the cohorts were called, but is that immediate classroom cohorts, is that a larger number of people, how many?
So as you know, Joelle, class cohorts are small, and all together with all of the class cohorts and staff, we called about 40 people last night.
I'm so sorry, could you tell me again how many people? I lost you for a moment.
Okay, about 40.
40 people, okay.
Mhm.
That's important, thank you very, very much. And the follow-up question I had about that is, in cases like these, are these 40 people asked to get tested? What is the public health advice that happens at this point?
So that's a great question, thanks for asking it. What we do when we contact these people is we identify whether they are a high-risk exposure or a low-risk exposure. Otherwise, are they a close contact or a not-so-close contact? At minimum, these people have all been asked to self-isolate, so they are not going to school right now, and that period of self-isolation is usually 14 days. The close contacts that have had ongoing exposure to these cases, they will be asked to be tested right away. But the majority of the contacts, we actually like to wait. It's probably better to wait at least 5 to 7 days, ideally 9 to 10 days after the exposure for testing, in order to ensure that you don't get a false negative result. So we will not be sending everybody for testing right away. Some will be asked to wait, but of course anyone who develops symptoms needs to be assessed and tested right away.
Okay. I think that's all I had. Thank you very, very much.
Okay, great. Thank you, Joelle. So now we'll move on to Greg Davis from Global. Do you have any questions for us today?
Yes, good morning. Just a question about the students. When did they get tested and were they in school with symptoms prior to being tested? Do you know anything about that?
So I think you're asking me about the cases that we have.
Yes.
I don't know where they were tested. I'm assuming they were tested here in Peterborough. And did they have symptoms? Yes. All 3 students had symptoms.
Okay, but do we know if they had attended school with symptoms prior to being tested?
So I believe 2 of the cases were in the school while they had symptoms. 1 case was not, developed symptoms on the weekend, but we, out of our extreme precaution, have contacted cohorts that would have been exposed potentially in that pre-symptomatic period. We certainly have evidence that the virus can be transmitted within that 48-hour period before someone develops symptoms. So we have used that as a way to identify which cohorts had to be excluded.
Okay, thank you, Dr. Selinger.
Okay, thank you, Greg. So Paul from Kawartha, you're up next.
Thank you so much, and my questions are all for Dr. Selinger. And I'll try to go quickly. I have a few. How was the student's COVID contracted? And any specifics around that? Like, was it at a specific event or during a particular activity, or is there any information there?
What I can share with you is that these COVID cases are linked to travel outside of Peterborough, and we have seen that consistently over the last many weeks, in that travel outside of Peterborough continues to be a risk for acquisition. And so we have another event where we have cases linked to travel outside of Peterborough.
All 3 cases, correct?
I believe, yes, all 3 are linked to travel outside of Peterborough.
Okay, thank you. And when you say that the students have been asked to self-isolate, have their families been asked to do the same as well?
I don't have that information, and but we can certainly follow up and let you know.
Okay, are the three students, known to each other? And when I say that, are they related? Are they siblings or?
So I prefer not to comment in detail, but I can tell you that the three cases are known to each other.
Okay, sorry, I just wanted to go back. I think Joelle asked about the total number of people that have been asked to isolate and monitor from Fairhaven. You said, I believe you said it was about 40. That's a mix of students and some teachers. Do you know what the breakdown is there?
So just to clarify, we're not talking about Fairhaven, right? We're talking about Adam Scott, the school.
Oh, sorry, did I say Fairhaven?
You did, yes. So, but I won't quote you on that. It is a total of 40, and it is a combination of both staff working in the school as well as class cohorts.
Okay, and just one more thing. As you've gone through this experience of Peterborough Public Health and the board as well, are there things or anything specific that you learned from going through this experience that you may apply or change procedures for other schools?
I mean, I think we're following the guidance from the province, and that's very helpful indeed, so that we are being comprehensive and careful and consistent. Of course, we will learn things as we go along. I think one of the things we learned was that, until we actually spoke with the teachers, we didn't realize that there were several teachers involved with the class cohort. And so now we know going forward that in a school setting, it won't be just one teacher for a class cohort. There may be 2 or 3. So that was a learning for us.
I know you've said it in so many words today and said it very well, but maybe I could just ask again. Parents obviously are concerned, certainly school staff and teachers and board officials. What's your message of reassurance? In a few words, just what can you tell them to kind of ease their anxiety today?
Take a deep breath. Take a deep breath. We've got your back. So we're working closely with the school. I'm very confident that we've been able to identify those people who should be self-isolating right now. We will work with them. We hold their hand throughout the whole process. We guide them through the self-isolation. We guide the cases through their illness and to the point where they are cleared and able to return to the school environment. And so again, for the public, if you need to take any special precaution, you will hear from us. You will hear from us. And I think certainly the events of last night demonstrate how quickly we can mobilize here in Peterborough. We're very fortunate. We have a cohesive community where we all know each other. I think to go from 0 to 100, like we did yesterday, from 4 p.m. when we first received the facts that we had a positive result, to 7:30, 3.5 hours, we had already identified the cohorts, the staff. We had the communication out to people who needed to know. We had staff in here working on calling contacts, and the fact that we were able to get to all those contacts so that they weren't in the school this morning, I think should be reassuring for all of the community, because it demonstrates that when needed, we will respond in a very timely and effective way.
Okay, and I have just one more thing, kind of unrelated. but if not, I mentioned Fairhaven earlier, and that's probably why it was in my head. Is that situation stable? Just an update on what's going on with that outbreak.
Yes, Fairhaven continues to be stable, and if it continues as it has with no additional new cases, hopefully that outbreak can be declared over next week.
Thanks so much, Dr. Self-Care.
You're
I know
welcome.
there's a lot there, and I appreciate it.
You're welcome.
Thank you, Paul. Now I'll invite Matt Latour from Oldies and Freak Radio to ask your questions, and if you can let us know who you'd like to answer. Thank you.
My first question is for Dr. Salvatierra. My second one will be for Chair Diane Lloyd. My first question was, you mentioned the 3 students that contracted the virus. They didn't get it at school and they got it from outside the community. Is there any community transmission at all in Peterborough right now?
You know, I certainly the evidence from the asymptomatic testing that we've been doing, thanks to the paramedics and the drive-through, is very reassuring. We are not finding asymptomatic people to be infected in Peterborough. Our positivity rates on those testing is almost 0. Sometimes we find people who may have had infection months ago when we weren't testing and may still have fragments of the virus that we're detecting with the PCR test. So we're testing thousands of people each week in Peterborough, and we're not finding positive cases. In fact, we went 5 days just recently with not a single new case, where that is not what's happening in many other parts of the province. So I have a high degree of confidence that there really isn't much transmission, if any. Is there any going on? I can't answer that question.
Thank you. And my second question is for Chair Diane Lloyd. I know it was mentioned that 2 of the students went to school with symptoms. What's the protocol for teachers and staff if they see a student with symptoms? Is it to call home and try to get them sent home, or how does that work?
Well, any child that shows symptoms or is in any way sick at all would be isolated from the rest of the school. There would be some place that's been designated in that school for that person to go. And then every effort would be made to make sure that that student was taken home as soon as possible, and that they would have to get a doctor's permission to come back into the school.
Perfect. Thank you. No more questions for me.
Okay, thank you, Matt. Now Rob Hamlin from Trent Radio. Any questions for us today?
No thanks, Brittany. I think everything I have has already been covered.
Okay, great. Then I will move on to Mike Poirier from Life FM. Any questions for our speakers? Maybe he stepped off. Okay. Mark, you are going to wrap it up for us.
Hello. How are you guys?
Okay.
I'll step back and put this down so you can hear me. We're seeing a lot of photos on social media of students gathering without masks on or off school property. What can we say to those students to be safe? This question would be for either the board or for Dr. Salvatierra. If you could
You
send
can
them
come
to
up
the
here
lecture
because his
office.
mic is here. Thank you.
Good morning. Thank you for the question. We have a policy that aligns with provincial and local health that it is mandatory for students from grades 4 to grade 12 to be masked at all times at school, unless it's if they're eating, etc. So on school property, that would be dealt with very seriously.
For those that are off the school property, maybe Dr. Salvatierra can address this one, but obviously the board can't talk to them about putting a mask on, but we're seeing groups of students together on sidewalks, convenience stores, that sort of thing, with masks, not wearing masks. What can we say to them about how serious the situation is to wear a mask?
Well, certainly being in the outdoors does offer a bit of risk reduction, given the ventilation and the ability for the virus to be dispersed. Also, ultraviolet light has an impact. So we consider the outdoors to be less of a risk, and we actually encourage people to be outdoors. However, we do recommend that if you're going to be outdoors and within 2 meters of anyone, you should be wearing a mask. So even if you are outdoors, That isn't, it isn't a 100% guarantee. If you're going to be within 2 meters of someone else, you should be wearing a face covering.
Thank you.
Okay, thank you, Mark. All right, well, I think we've given everyone a chance to ask their questions. Feel free to email with any additional ones. Thank you for joining us today, and have a great day, and keep that mask on. Thank you.
Well done today, thank you.
Thanks,
Bye. Thank you.
thank you.
Good. Good job.
You did a great job.
Diane.
Excellent.
That was great.
Thank you all.
Yeah.